Welcome to San Diego Oasis and our phenomenal webinar to answer the question and engage you in a discussion. We titled it, We've Got Our Shots, Now What? And this conversation for the next minute will focus on physical and emotional health of us and where we've been in this past pandemic year, and really charting our personal path of where we're going to end up, each of us, in our journey to the new normal, whatever that may mean to us. It is my pleasure to welcome all of you, and it is my pleasure to introduce three experts on the panel today. Before I do that, a couple housekeeping items. You have on the bottom of your screen two boxes. One is called chat box, the other is called questions and answers box. Our staff behind the scenes will be monitoring both boxes. So if you want to chat to each other, offer thoughts, comments to each other, please use the chat box, chat away. If you have some great questions and comments to our esteemed panel, please use the question and answer box. As I mentioned, we'll spend the first hour hearing their thoughts and their leadership, and then we'll focus on your questions and comments for the last 30 minutes or so. Let me introduce the panel. I'm delighted to introduce to you Dr. Ken Druck. He's a best-selling author of Courageous Aging. He's a very well-known speaker, executive coach, consultant, community leader, and truly an expert on human resilience. He has helped countless individuals, families, organizations, and communities turn their greatest challenges into life-enhancing opportunities. Welcome, Dr. Druck. Next, I'd like to introduce to you April Hall. She is a registered nurse, a care coordinator for the Gary and Mary West PACE, located in San Marcos, California. She has been a registered nurse for more than 10 years and has worked in many different areas. To include a few, it's home health, skilled nursing, and rehab environments. Finally, welcome to Dr. Daniel Hoffer. Dr. Hoffer is a board-certified family medicine doctor at Sharp Rees-Steely, and he's been serving in that capacity for more than 28 years. Dr. Hoffer is also a board-certified palliative care physician. He often describes his work with older patients as truly a calling that allows him to provide patient-centered care not only to the patients themselves, but also to all the people who love them, the family, the friends, the circle of influence. Welcome, Dr. Hoffer. So I'll open this thinking journey about the past and the future with a couple thoughts from my personal experience and of our team leading San Diego Oasis, which is focused on older adults. We've witnessed some older adults being remarkably resilient, having adapted so quickly and so far, while others really just embracing depression early on and having a very, very difficult time. And as you know, depression may start mild and fairly unnoticeable and really lead to physical, cognitive, and social decline that it could be noticed by anyone around them fairly steeply, fairly quick. So on the one positive example, I can share a story of two ladies. One of them is a mom who lives in Northern California. The other of them is a daughter who lives in New York. Now, these people don't even live in San Diego. The pandemic has forced them to look at their lives and their communication and their engagement with each other in a brand new way. They looked in Northern California, they looked in New York, they couldn't find anything fun to do, and they discovered San Diego Oasis and our virtual programs. So they've decided, we both love photography, let's take a virtual class together, and then let's take pictures, let's encourage each other, let's share notes. So this duo has been taking photography class every single week and re-engaging with each other in a brand new, fantastic way. On the other hand, a very prolific class taker who's an Oasis member, who used to be at Oasis pretty much every day. You know, we've called and checked in with this member, and living in a senior living care facility, she was not allowed to leave her room. So week after week, month after month, this person was delivered a meal to her door. And we've just noticed such a quick decline in her presence, in her mood, in her engagement in life. And while she had technology in her room, she really struggled to connect. So these two, serve as sort of both anchors at both ends, people, older adults who've adapted early and well, and those that have really been suffering. So we've kept in touch with that member, and I think we're going to see that member back in class, engaging and laughing and hugging with us as soon as we're able to open. So let me make a couple thoughts known about reopening and how we're thinking about it. We've asked our members to give us feedback, very specific feedback, to give us some ideas how they're feeling about our reopening. So I want to share a few of those survey results with you. And again, those of you who have been Oasis members, thank you for your response. If you're an Oasis member and you haven't given your feedback, the survey is still open, so please do. All right, so here's what our members have said. 800 responses are represented in this particular sample. How many of you have been vaccinated or in the middle of vaccination versus definitely not planning to vaccinate? As you can see, only 3% of this 800 response sample are not planning to get vaccinated. Everybody else is already vaccinated, halfway there, or a little bit undecided. But really that gives us a very good idea that 97% of our members want to be vaccinated and they're on their journey to do so. The 3% are definitely planning not to get vaccinated. Let's go to the next slide. Once we're able to open, how are you going to participate? Here's where we're looking for a behavior change. Has the pandemic really changed how we want to get engaged, how we want to belong? So in person and clicks and bricks, meaning sometimes in person, sometimes online, is the majority of the responses. You can see online only, that's a smaller segment of the members who could be like that mother and daughter team from New York and Northern California that couldn't even come to us. They also probably represent a good amount of people who could come to Oasis sometimes in person, but not as much as they would like to. So sometimes they might get in a car and drive, and sometimes they might stay home, especially if they're caregiving for grandchildren or a spouse or a family friend, perhaps. Let's go to the next one. We asked specifically, where will you go? Again, very small segment of staying online. Everybody else is picking their favorite San Diego County-based Oasis locations. Let's go to the next slide. This was an interesting say. If we were able to open gradually and we had to choose which of these classes we could offer in a limited capacity first before we're able to open everything up, there's definitely no surprise here. Those fitness and dance and physical activity classes typically are not working too well online. There's the music delay, there's just other things that, make the exercise fun, much more impact in person. Very much technology workshops as well, where the instructor can walk around the room and help you with your device or point something specific. And of course, some things that do work really well online are the least on the list of desired first on the list, right? So those could be history lectures or writing workshops. Those tend to work very well in a virtual setting. Let's go to the next slide. We asked you, how willing would you be to show the proof of COVID vaccination if required? Again, you see that very small segment of 2 to 3% undecided or going with a no, I would not be willing, but the vast majority, again, the high 90th percentile is very happy to show their card of vaccination. Again, similar question about wearing a mask, and you see the vast majority to be very happy to be wearing a mask and very eager to come back with their mask, with a card in hand to participate in the most preferred way. Let's look at the next one. This is asking people how they're planning to travel. You may have heard the report that San Diego County Tourism Authority recently released. And basically it said, our hotels are starting to fill up, and guess who's there? Older adults. They're the ones that got the vaccination. They're on the airplane. They're at the hotel checking in and taking that vacation next to family or friends. So you could see that of the 800 sample, the majority are not planning to travel in the next 6 months, 8 months, no plans. And we asked it for this travel would be a week or longer. So like a real vacation, not just a weekend away. And you could see that about 100 people or so are traveling about each month from the 800 sample. And the next slide. Well, hopefully this was interesting to you, as it was as really, really helpful to us, as we are now looking at who's vaccinated and who's eager to become engaged again. So hopefully that was interesting to you and helpful. Now I will turn our attention to our esteemed panel, and I will start with Dr. Hoffer. Welcome to the panel, Dr. Hoffer. I would like to start with a question about your oldest patients, your 50 plus, 65 plus patients. How has the last year been? How the pandemic has affected your patients?
That's a great medical question. And first of all, thank you for having me as one of your panelists. And when it's my turn, I'm going to take your history classes, your dance classes. I'm going to learn Italian and French, and I'm going to stay engaged. So that seems like a great program for everybody. I would say when I respond to that as a family physician, I also work as a palliative and a hospice physician, that it just depends on who you talk to. And you've already pointed out some of that. It is very difficult for some people to remain in their homes and be socially isolated. And I would put it to you the way my mother put it to me. She's moved down near me, 3 townhomes up. I live in Tierra Santa. So I'm coming to you from Tierra Santa. And she said it was easy to stay in my home when nobody told me I had to. But now that I have to, it's such an emotional burden and worry to stay here. And I think a lot of people feel that for fear of going out, the difficulties of going to the grocery store, engaging in their normal activities. We are social beings. It's important to engage with our neighbors, our friends. Minor things became major things. You're making sure you're far apart, making sure you're distanced with your masks, those types of issues. But as you pointed out, for the advanced elderly and people in RCFEs, residential care facilities, or nursing homes, or even the hospital, loved ones can't go and visit. And one of my favorite stories, it's unfortunate, but a real story, is a story of a 100-year-old who, sharp as a tack, living in a RCFE. She said, well, they locked us in our rooms, brought the food to our room, just as you explained, and they stopped all the activities except once per day while we're all in our masks, they would bring us out into the courtyard and put us 9 feet apart. And they said, well, you can all talk to each other. And she said, except for one problem. We're all hard of hearing. And so basically it was nothing except to be in the same courtyard together. And so that level of social isolation is a huge problem. And from a medical perspective, once you retire, social isolation is the #1 predictor of premature death. And so if it's not enough medical evidence to say you just want to live better by being socially engaged, I can tell you that many cultures around the world value the social engagement and having purpose, such as going to your art classes or language classes or history classes. Those people have recognized the importance of social engagement. And the Okinawans, who are some of the people who live the longest, call it ikigai, which is purpose. What is your life's purpose? And that does not end when you end your career. You're just in this 3rd stage of your life where you need to find out what your next purpose is and engage. From a medical standpoint, for the younger population that may still be working or still be older but still working, they found it very hard to stay at home. It's not structured for them. We like structure. And so what I told to all of my patients was, you know, and you can ask yourselves on the video right now, how many of you did not get out of your pajamas until 2 in the afternoon? That is not a good thing to do. You should get up, you should take your shower. You can take a little bit longer for breakfast and your coffee, but you need to do your exercises. You need to engage in some type of thinking. You can watch your TV show for 1 hour, but not all day long. And then you need to get on the phone or on the video with friends and family to engage with them the best you can under the circumstances. That level of social inactivity and social engagement and purpose caused diabetes to get worse. We saw more heart failure problems. We saw more heart disease. And this is all documented in social isolation even before COVID. COVID just made it a lot worse, unfortunately. And so, but you can find structure if you have guidance to do it and you know how to do it. But you have to be motivated and you have to accept change. In the history of healthcare, COVID's not new. We just called it other things such as the Spanish flu, which hit America in 1918 and killed millions of Americans, and everybody locked themselves inside. But we still need to recognize the value of staying engaged even during these pandemic situations. So that's how I would respond in a brief, non-specific way to your question.
I think your comment to the structure is particularly valuable and so easy to do in the beginning and becomes so much harder to get to. You know, I didn't stand up, but I am still in my pajamas. No, just kidding. Just kidding. I'm not. I want to ask you as a doctor, do you talk to your patients about carrying COVID vaccination cards with them? Do you give them any guidance or advice? What is it?
Well, in circumstances where they would need to have a COVID card, absolutely. So if you're going to travel, for example, and somebody previously asked me about the travel out of the country, it would be a great idea to have your COVID vaccine. Sorry, I can't get my cell phone to work now, but there is a CDC website called CDC Travel Well, and you can go onto that website and you can see the vaccines and what evidence you have to be able to travel to different countries. And that's not just unique to COVID again, it's been there for quite some time. So I do think it's a good idea to have it based on what you're going to do. Now, there's probably other activities where you need to prove you've had your vaccines. It's good to know you've had your vaccines and been vaccinated if you're going to go into your doctor's office because they are doing a significant amount of screening. There's probably other areas. But being aware because of the sensitivity among the activities that are going on right now, I think it's just a good idea if you've been vaccinated to keep that information with you, whether you wish to expose it or not. You may be forced to expose it at some point just to be able to access certain activities and tools.
Excellent. I want to ask you about this idea of vaccine passport. So whether you're traveling just to your favorite coffee shop or library or Oasis Center or your doctor, wherever you might be taking or traveling internationally, there's been this idea floated by the airlines actually that we would create a system where we could load up our vaccination record and then everyone can share in that to make just traveling and participating easier. What is your take on that?
That is a very interesting take. From a pure medical perspective, nothing else, it's a great idea. From a violation of privacy, huge problem. So, and you didn't see a lot, but some people don't want to volunteer that information, and there may be good reasons. I'm not here to tell people who they are, but from a societal reason, it's probably a very good benefit for people to know if they're in a room that people that have been vaccinated. In a couple of months, I will be going to give a live presentation to other physicians regarding geropalliative medicine and the importance of understanding our geriatric population. And it will be in a room that I would certainly like to know if everybody was vaccinated, because it may depend on whether I keep my podium 3 feet in front of them or 20 feet in front of them. And I hope there's good ventilation, and in that regard, it would be medically a great idea. But I think that's a tricky question on many levels. So, but from a physician, I'd say, yes, I think that's a good idea. Certainly going into hospitals, it would be good to know who's been vaccinated. that might open up the ability for people to visit their loved ones quicker.
Thank you. The next question is in the context of vaccines are definitely coming to every community and coming fast, which is so welcome for all of us who are eager to get vaccinated. Is there some specific medical advice as a physician you would give to older adults specifically, now that things are getting opened up, now that more and more older adults are fully vaccinated? Anything we should know?
Well, I would say get the vaccine. Just that's the most important thing I can say. I am a huge advocate for vaccines. Anything you do in life, anything you put in your body is a risk-benefit analysis. And let me put it to you this way. If I had a medication that caused seizures, blurry vision, headaches, heart attacks, fluid overload and congestive heart failure, electrolyte abnormalities, diarrhea, abdominal pain, and swelling in your legs, would you use that medicine? That medicine is clean water. And so for all of those people who said, I would never take it, you're taking it every single day. You're just balancing the risks and benefits of drinking fluids. So when we give you a medicine, you eat a food, you get a vaccine, you're balancing the risks and benefits of getting that vaccine. And so yes, there are some side effects with these vaccines. It is not the easiest vaccine to take. Most of us don't feel good after the second dose. The first dose in the 2-dose vaccine, the mRNA vaccines from Moderna and Pfizer, the first one's easy, the second one's not so easy, and there have been people that have been sick for several days, even a week, but they all get over it. The second vaccine that has come out to the US is the J&J vaccine, and that's a adenovirus vector vaccine. That's a single dose, but people are getting fevers and chills for a couple of days. But the benefit far outweighs getting COVID itself. And the one thing I can tell you about all of these vaccines you should be aware of, that they are 100% effective to date against death and ICU utilization, two things that people should care about. So even if we don't cure COVID completely, we want to turn COVID into another cold or flu. That you just live with it, it goes away, and then you're fine a couple of weeks later.
Thank you. That's definitely important. Thank you for that example of risk versus benefit. From your own perspective, take us to the future. As we start to think about what will my life look like now? Things are opening up. People are eager to see me. Can I have family, friends, neighbors? How can I think about this from purely medical standpoint? What is your advice for them?
Well, I would suggest if you have 2 vaccinated people, you're very safe, and it's unlikely that you need to wear masks or isolate as much if it's family members anyways. And at some point we are going to return back to normal. The question is whether we do that tomorrow or whether we do that 6 months or a year from now. It's unlikely, unless there is a culture change, that we will be wearing masks for the rest of our lives. But for those of us who have traveled around the world, there are cultures that wear masks all the time. So if you go to Japan and get on the trains, you're going to see that they are wearing masks if they have a cold or a flu or a runny nose. It's just a courtesy to the people around you not to spread your infection. So in the future, I would hope, and I've always hoped this even before COVID, that we would start wearing masks in this country when we're sick, wash our hands more, and I would encourage people to stay home from work when they're sick. And doctors are the worst, just to tell you that. We love going to work when we're a little bit sick, and all we do is spread it to our friends and our colleagues and our patients, and we really should have taken our own advice and stayed home until our illness had gone away. So I think the future is going to be back normal. I predict it's going to be within a few months to somewhere near the end of the year. Economically, that's a different story, but medically, I think there's going to be enough people vaccinated. To date, I think we have about 86 million vaccines that have either first or second dose. And if you add that to the number of people that have had COVID, and you add that to the number of people who have had it and we don't know, we're probably over 50% of people having some level of immunity, which is why you saw yesterday that the COVID rate in San Diego was 1%, had dropped precipitously, and we only had 200 cases with, I think, about 13,000 patients being checked. Only 200 had actually COVID, even though they all came in to be COVID tested. So I think we're getting back to that point where we can return to normal. We still need to be smart. There's nothing you don't ever need to be smart about. You have to be smart about how you do this. Wash your hands, cover your cough like this, not like this. And you should be getting your vaccines just to keep yourself healthy. Because in the COVID era, if you get the flu, everybody's going to presume you have COVID and not want to be around you. So just a smart thing to do.
Thank you so much. All right. I'd like to turn now to April Hall, who's a registered nurse, also a healthcare professional. April, why don't you tell us, you work at PACE, Gary and Mary West PACE in San Marcos, California. Tell us what PACE is and why PACE is important to older adults.
Okay, so PACE is a PACE. It stands for Program All-Inclusive Care for the Elderly. We direct our care to those who are 55 years and above. There are 4 qualifications to be able to participate in our program. So 1 is that you're 55 years and above. 2 is that you live in our service area. So each PACE program basically are assigned certain zip codes that they can service. The 3rd qualification is that you do have a home that you can live in safely, or at least with some assistance could live in safely. And the 4th is that you meet some sort of level of care. So unfortunately, you can't just be a 55-year-old man who's still driving around, navigating through internet. They basically would need, maybe some help grocery shopping. They're not driving anymore. They have multiple diagnoses, and managing their medication is just really hard. The healthcare system, a lot of scheduling is now online, and that can be very overwhelming for that generation. I like to kind of picture the PACE program as that big red easy button. It just simplifies things for our participants. We, as their care team, can do all the scheduling. We provide transportation to and from appointments. We can provide you home care. You have direct access to your clinical team at all times. We basically become an extension to their family. They have that support system that unfortunately a lot of the elderly don't have. As they grow, their children have moved to different cities. They have their own lives going on, unfortunately. They have their own children to raise, and it's really hard to be in 2 places at the same time. So the families really look to us to provide that support. So it's really great. It just simplifies everything. Most people are dual certified with Medicare and Medi-Cal, which makes it 0 out-of-pocket costs for them. We've had a lot of participants who needed to take medication but couldn't afford to do it. And since joining our program, they can do that, and they're getting the help that they need, and the socialization. It's just all around. In my many years of being a nurse, it's a program that I go to sleep every night feeling really fulfilled that we're making a difference. So
I'm sure you are, both to the older adults and their loved ones. I'm sure you service a lot of older adults who don't have immediate family very close to them, physically speaking. So kudos to you and your team. Tell us a little bit about, so PACE is an on-site program. Elders come to you to get healthcare. Are you open? How are you open? And talk a little bit to us how the seniors are dealing with you being open and what arrangements you've made. And also talk to us about the staff. How was it for them to return to work in this time of uncertainty?
Right. So the first question, are we open? Yes, we have been opened, but just in a different way. Our clinic team, our clinic in the center has always been open. We've developed teams, basically. You'll have your primary care provider with the nurse, their social worker. the therapist, and we've alternated kind of days that we're able to go into the clinic to kind of create that ability to social distance and limit who goes in and goes out. The appointments are, coming into the clinic is set by appointments only. Unfortunately, at this time, our day center for the socialization has been closed. Our hopes is that we are able to open in the next 4 to 6 weeks. I know that our leadership is closely monitoring the CDC and CMS guidelines in order to create a plan for us to do so safely. The talk is that we would begin to open in small cohorts, little group here, and then bringing in another new group, smaller group. Our team right now is kind of going through the number of participants that we have to really pick which ones kind of need it the most, who has been really hit the hardest with the inability to come in and socialize with us. Our participants have been amazing. You know, in the beginning, there was a lot of fear. There was a lot of unknowns. Some participants wanted no more home care. They wanted to stop visits. They moved in with families. They didn't want to go grocery shopping. So we provided delivery of groceries and essential items like towels and soap. We've provided masks and gloves to those who needed. Other participants were less fearful and were willing to venture out to go grocery shopping with the help of our caregivers. Our staff members have been troopers. I know we all personally, you know, weighed the risks and benefits of exposing ourselves and our safety and our families. But I think the great thing about our program is everyone has just these huge bleeding hearts, and we do what we can, and we think outside of the box to come up with solutions to make sure that each one of our participants' needs are met, but safely. So it's been really good. We miss everybody immensely. We've implemented programs like Care.Coach for those who still seek socialization but can't do it in person. It's basically a tablet that has a little talking dog or a talking cat, and it talks to them. And there's great volunteers on the other end who are able to check in on them, chat with them, remind them to take their medications. It also has an ability that if there's a concern, it does have a video component where we can then face-to-face speak with them. If they got a new cut or they bumped into something, we can visually assess it. And they've been really troopers because it's just been a complete change on how we've had to adapt to a pandemic. And it's just the resilience in these folks, it's just been amazing for everyone involved.
Thank you so much. There's a lot of research actually pointing to the resilience of older adults. You know, society, which we at Oasis know is to be very true. We know 6,000 people typically show up at our doors and they want to learn, and they do learn, and they build on what they learned yesterday, today. So that resilience is definitely amazing. Any challenges you've experienced? Because some of us are very fearful about, will there be conflict? What about people who comply and not comply with whatever the business is asking them to do? Have you had any instances of that, of conflict, of uncomfortable situations from some viewpoint?
I wouldn't really say it's a point of like conflict. Of course, everybody has different points of view. I feel like the way that we've approached it is that we've left open communication. We've been able to develop trust with our participants. And because we treat them like an extended family, I truly feel that they do not believe that we will steer them in a wrong way. So we provide the education, we answer the questions, and then at the end of the day, we honor their wishes. If they choose to get vaccinated, wonderful. If they don't, we understand that. And we treat everybody the same. When people are coming into the center, we just apply the same safety rules, the double mask, the social distancing, the temperature checks, the symptom checks. We never make anyone feel bad for making whatever choices that they do. Yeah, it's just,
You're making it work. Sounds like your team is
Yeah.
hard at work. You love your clients and your clients love you. And I'm sure the surrounding families are just so tremendously grateful for your work. Thank you, April.
of course.
Dr. Druck, let's turn the microphone off and ask you a couple of questions. I know that you have personal loss recently, so it's probably been a difficult time for you personally. And you're also bringing your wealth of knowledge and experience as expert in grieving and human resilience. How have you and older adults around you, from your academic and your personal point of view, have fared during this last year?
Thank you. And it's so good to be with all of you. Here we are embodying the very thing that we're all talking about by gathering in this imaginary space that we've made real. And so I'm appreciating that. You know, I have suffered a loss. One of my favorite aunts, who is actually a Holocaust survivor, did not survive COVID. And she passed 3 weeks ago. So we've had a recent loss, my Aunt Marion, who was in her mid-90s, who had had a full and remarkable life. So, you know, many people who are listening are grieving the loss of a loved one, a life loss. And then many of us are also grieving what I call living losses. Nobody has died, but the future we had planned, whether it was the travel we planned, the friendships that we thrived on, the connection with our family that fed us, fed our souls, it gave us the things we did at Oasis that gave us a sense of purpose and learning and excitement and adventure for this season of our lives. All those are losses that we have been grieving. At the same time, you also said, you know, what else has been going on? At the same time that that's happened, I've been enrolled in the care of my twin 18-month-old grandsons. It never would have happened. A nanny would have been there, but we're in a no nanny world, you know, for a lot of people. So grandpa got enrolled as a caregiver. I've had a closeness with my grandsons. I'm on the floor. This morning, I was on the trail at Torrey Pines, you know, telling them to see the bird or the airplane flying out from Miramar, the tree, the flower that's blooming, taking a hike, singing songs, listening to their miraculous sounds. So I think it's so important that we realize we're living in a both and world. We're both suffering the losses that we need to cry and wail and vent and talk about and be angry and upset about. And we need to air out the losses that we've suffered. But we also need to look in the other direction, because some of us will discover that there have been hidden gifts and blessings and miracles. How many people do we know in the same sentence, they tell you they gained 15 pounds. They'll tell you that they've also started reading again, or that they have time to think and reflect about their day and how they want to spend it. You know, especially people who are retired. Now, appreciating those, also appreciating that not everybody has that luxury and ability, that people in service jobs have had to be there every day and deal with, are they going to wear a mask? Do they really value my health and well-being? Is there room? I love what Dr. Dan, you know, shared about that, because it's really been an opportunity for all of us to weigh in, to look at our neighbors and our friends and our coworkers and people on the street and see to what degree has somebody made this a very personal issue and compassionately concerned with my well-being and health, since I'm one droplet away from contracting a disease, a virus that could take my life. how much are you, even though you might not know me, are you concerned about that? And how much are you on a political stint that you don't want, it's taking away your liberty or creating an inconvenience in your life? So we've been sitting in the middle of all that, the lost sense, and maybe that's an opportunity that so many things that have been under the surface have been outed, and that we're now in conversations about what we believe in, what values we have, how we can treat one another with the utmost care and respect. And we're fortifying those beliefs in the common good that many of us hold. So it's a mixed bag. It's been a mixed bag for me, and I think it's been a mixed bag for most all of us.
Thank you, Dr. Druck. You are a psychologist by training. You've spent lots of years of coaching people through difficult circumstances. Help us understand how you would approach it. Some positive planning for each of us towards that normalcy. How do we think about that? How do we prepare ourselves? What does that mean?
Well, I think the first step is to always to take personal inventory, or the time we spend looking at ourselves in the mirror and reflecting on how we're doing. And you can go down the spectrum. How am I doing in my closest relationships? How am I doing in my renewing my sense of purpose and significance in this life? How am I doing socially? We've talked about people disengaging or engaging. How am I doing in my moods and my health practices? So we can go through the full spectrum of how am I doing, but I think the first step is really to do a self-audit, to take inventory. How am I faring? And to be honest with ourselves. And if we discover that, you know what, I could be doing, I need to summon, as I have at different seasons of my life, when I became my first job, when I became a dad, when I became a mom, when I faced a tremendous challenge, a health challenge, when I suffered a loss, we've summoned newfound courage, faith, strength, clarity, understanding, perspective. And this is a time where we may look at ourselves in the mirror and say, you know what, I need to make an attitude adjustment in how I'm approaching things. You know, I've been biting my partner's nose off with all the feelings that I have. I have such mixed feelings in this COVID world, you know, and I've been biting people's noses off. Or, you know, I'm getting lately, I grew a COVID beard. How many of us, you know, had to really look at, how do I take care of myself? Do I grow that COVID beard and get that COVID haircut and color my hair so that I look younger or whatever? So now we're facing the question, do I want to keep the beard? We're hopefully moving into a non-COVID world. Is it okay to go on a podcast with my COVID beard and long hair and my sweatshirt and the hat I've been wearing for the last 9 months? So all these questions can be addressed. I think we take personal responsibility and inventory for how we're faring. And everything good comes from that personal reflection, responsibility taking, and accountability. Because if we don't know ourselves and we haven't taken account of ourselves, we may project feelings onto other people. You know, what's wrong with you? Why are you not doing this? And suddenly our feelings are getting projected outward because we haven't taken inventory inward. And I think that's always a good step. The second thing is to acknowledge all the good things that we've done, all the ways that we have shown up to meet the challenges of COVID, the ways we've taken care of our family members, ourselves. And sometimes I tell my clients, get your foot off your throat and put your hand on your heart, because we're so self-critical. We're so harshly critical of ourselves that all we can think about is what we haven't done. Where's my to-do list? You know, what haven't I done? What do I need to do? We live with pressure and with self-condemnation and criticism, rather than saying, what good happened today? What good have I been accomplishing? What can I give myself a pat on the back for? even if I'm not getting it from other people, how do I commend myself and put our hands on our hearts? Because I think that strengthens us, because we have a friend always. It's us. We're becoming our own best friend. The next thing is, I think, and April said it so beautifully, and Dr. Dan said it, and Simona, you said it as well. We need to engage. There's a challenge in the air. We're isolated. We've got to be creative. We've got to push ourselves to engage, especially those of us like me who are stubborn and don't, admit, I think I can do everything myself. I don't need help. I'm staunchly self-reliant, and my receiver is broken too. If you try to give me a compliment, I'll deflect it. So those of us who are stubbornly and difficult, we need to get over the false pride and say, it's time for me to reach out. It's okay for me to ask for help. It's okay for me to get some hand holding. And I need to be proactive and reach out and initiate. I need to call Oasis. I need to get the brochure and see what's cooking, because they say that happiness is, someone to love, something to do, and something to look forward to. Well, let's get on that line. You've created a menu, a delicious menu of possibilities for what's coming. If we can all stay still diligent in the way Dr. Dan is talking about, let's get through this and let's party at Oasis a couple of months from now.
Oh, I like that idea. I'm a party girl. You're all invited. We definitely want to open the doors and bring the joy back, which is really irreplaceable in any other format. There is something about being together, hugging, sharing a joke, finding some commonality just in a casual remark. There's really no format online for that. So I can't wait. I want to ask you one last question. I've heard the term pandemic PTSD. What does that mean? Do we care what to do about it for ourselves and everybody around us?
Let's take the D out of the PTS. Let's not pathologize that we have a disorder, but let's think about the fact that, and some of us might have drifted into a disorder. Don't get me wrong, for which we need professional help, and that's okay. And we've seen a greater amount of people who do need professional help. I had a client who needed to go into the hospital last month. Guess what? There were no beds open. Hospitals closed. There's no room in the hospital, in the psychiatric hospital, because so many people are feeling the weight of that stress, and they reached a breaking point. And thank goodness we have wonderful hospitals to help. But let's talk about stress, post-traumatic stress on one end of the continuum, but let's go over to the other, which is post-traumatic growth. Because some of us are we've experienced the trauma of having to change our whole lives. Some of us through losses, some of us through losses of jobs, losses of our kids being in school. Our whole lives have changed. So yeah, we're experiencing the stress of this radical change in our world and in our lives. So the stress is real, and it may be traumatic for us. And how do we deal with that stress? But how do we also recognize the parts of us that have grown? Look at how creative I've become. Look at what I'm doing, in this situation, that we've grown as well. So we need to manage both, appreciate the ways we've grown and continue to grow and be creative and venture out and try new things. But at the same time, to meet that stress, to have a safe place that we can talk with and people that we can air and vent with about, the question here, I'll save somebody a lot of money. If you came to see me as a client, I'd ask you two things. What's weighing most heavily on your heart? And I'd listen for a long time. And then I'd ask you, what's making your heart sing these days? the answers to those questions are so important. And each one of us can use somebody in our life that we can talk to about both of those questions. Make sure that you have somebody, and even invite somebody to be that person for you. It might be an upgrade of a relationship you have with an adult child who's a great listener, or a neighbor or a friend who you could sit socially distanced from in your driveway or in your apartment or in the lobby or somewhere. But to make those conversations real, to create the safety, create judgment-free zones where it's safe to say what's weighing most heavily on your heart and what's making your heart sing.
What a beautiful 2 questions. Thank you. So we're almost at the top of the hour, and I promised to have this facilitated conversation first, and then take a couple moments with Dr. Druck's help to take a exercise. So we'll take the next 2 minutes, and after that, we will start taking your questions. So if you do have questions, please type them into the question and answer box. We will be pulling those questions and comments for any of the panelists from that box. So Dr. Druck.
So this is the moment. We've had such wonderful things said and shared, and we've gathered with each other for this time. And now we're about to kind of wind the time down with some great questions. But let's take a moment before we go to that, a moment inside with that hand on our heart, that hand of kindness, of support and encouragement, that hand of patience and understanding, possibly even forgiveness. To understand that we've been on a journey, we're on a journey. A huge curve has been put in the road. And the journey we've been on for some of us has been treacherous. We might have gotten sick. Somebody we love might have gotten sick. We might have had to say goodbye to somebody we love, whose life is as important to us as our own. And we might have suffered other losses. The loss of where we live, the loss of seeing grandchildren, of seeing our children, of being together as a family over the holidays, or just any days. And we've had to make all these adjustments and changes, and they've cost us. And here we are in this moment with an opportunity to take a deep breath with that hand on our heart and to affirm and acknowledge ourselves for the journey we've been on. And here we arrive in this moment of choice, this moment of opportunity, this moment of beginning to write new chapters of life. And on the horizon is such hope. Thank God for these vaccines. Thank God for the therapies that are going to prevent many of us from dying, even if we get sick. Thank God for Oasis, for a place where it's going to be safe to re-engage, rediscover, even now to do that, to create that social world of richness, of sharing, of reconnection, of reviving our sense of purpose, of learning new things, of lifelong learning and growing. And so this is a moment to begin writing those chapters and to start the writing of that chapter with one beautifully positive statement to yourself. And I invite you to think about what you want to say to yourself with your hand on your heart, with encouragement and kindness and gentleness and patience as you begin to write. new chapters of life. And let's all end with a deep breath to allow that to go all the way in, that beautiful statement of encouragement. And let's move into our final wind down of sharing of questions.
Thank you, Dr. Druck. Beautiful way to put us together into this moment. I will start with a question for Dr. Hoffer. The question is about vaccines. What are they made of, and how do they affect our bodies long term?
Great. So that's a great question. First of all, I have to thank all the speakers. That was fantastic. And I do want to make a comment that I would have said the opposite of post-traumatic stress is post-traumatic joy. And you don't have to be sad when trauma is over. You grow from it. How many people had a bad experience with cancer or a heart attack or something, and they learn to recreate their life and let water bounce off them like water off a duck's back? You learn those things, and you can learn them at any age in life. What a fantastic thing. I'd make one other philosophical comment because I just read this yesterday. I am reading more as well, and I'm reading more than just medical journals, thank God. And it's a philosophy book, and it's the Daily Stoic, and it was referring to another philosopher, so I'm not going to give assignment to anybody. It's probably for all philosophers. But it said, wherever you go, there you are. So if you want to solve your problems, it's not going to be by traveling somewhere else or going on vacation or fixing, the environment around you. It's going to be by looking internally to listen to everything that Dr. Druck told you and taking it personally and saying, that's where you start. You take assessment from where you're at, and you move forward from there. So let's get on to the actual question, which was about vaccines. The first two vaccines were mRNA vaccines, which means that it's a new type of vaccine. It's injected into your muscle. The mRNA is not DNA. You will not grow a second eye or a third eye. You will not grow an arm on your back. You will not get smarter, taller, more handsome and beautiful. Otherwise, I would have had 14 vaccines by now, just to make that happen, and hope that I got all of that. What happens with the mRNA is you inject it into your muscle, and your body's proteins create the outside receptor proteins on the COVID vaccine, and your body recognizes that as foreign and create an immune response. The mRNA, it just dissolves and it goes away, and you have this new protein that the body can identify as foreign. You get a primer shot that most people tolerate very well, except for a sore arm. And then the second shot, you get the booster, and you get a more of an immune response. And that will stay with you in your B and T cell memory cells for, hopefully, we don't know, but we're hoping for your lifetime. But as with most vaccines, like the flu vaccine, and we are working on a universal flu vaccine, you will probably have to get that at intervals to keep it at bay. The newer vaccine, the Jnj Vaccine, is an adenovirus vector vaccine. So it carries the protein on a previously known virus that your body is aware of, and it attacks that and attacks the protein to create the same memory cells to attack the real virus if it were to ever show up. And that's the basic issues going on. Now, all of these viruses, I want to tell you, because a lot of people are afraid of how rapidly these vaccines were created. In fact, I think what was done was brilliant. They got rid of the red tape for the humanity part. They got rid of the worries about financial concerns from many of the producers of these vaccines, and said that we as taxpayers and the government will support production. And they added the evaluators into the vaccine creators' laboratories and said, we are going to monitor you while you are creating the vaccine. Now that process, over the normal, regular process, can take anywhere from 3 to 10 years to create a vaccine. But it was done so expediently and so efficiently without the barriers to help everybody that we not only created one vaccine, but multiple possible vaccines, because we didn't know at the time which one was going to work. Fortunately, they all work, every last one of them. And so you can have your choice of a 2-shot vaccine, a 1-shot vaccine, an mRNA vaccine, an adenovirus vaccine, and there's some newer vaccines coming out as well. But the long-term concerns for these vaccines, very low. We don't even know that there's any long-term effects from these vaccines. The allergic response, we are aware of that for a few of the vaccines, but in the first 45,000 cases of the vaccines being given out, there was 3 truly allergic responses. 2 of those patients ahead of time knew they had allergies, severe allergies. 1 did not. So the ratio of risk is 1 to 45,000 if you don't have severe allergies. So you can balance that with the risk of getting COVID, which is very high, and say the risk-benefit analysis is get the vaccine because we don't know, for whatever reason, some people don't even know they have it. Some people end up in the ICU on ventilators.
I will ask you one other question, and it's on a lighter side, Dr. Hoffer. May we get a massage from somebody who's wearing a mask? Is that okay?
That's a great question because I love massages. And first of all, you can get massages from your spouse or partner at any time. And, that's a great thing to do. Human touch is undervalued. I just wish we had more human touch as a medicine. I'm going to prescribe you 5 hugs today. It's just a great thing to do. And so as soon as you can hug somebody, do it because it will make you feel better immediately. And that's human touch. If you're seeing somebody who's giving you a massage, who has a mask on, that is a prolonged exposure for more than 15 minutes, and that's the usual amount of time we start to worry. It's a little bit arbitrary when doctors and the CDC and healthcare providers give out 15-minute intervals, but that's the cutoff that most literature looks at. So it is a prolonged exposure. Of course, it would be better if that person was vaccinated, but I can tell you that if you go into a room and you have a mask on, your risk of developing COVID, if somebody were infected in a group of people, drops by 50 to 75%. If the other person is wearing a mask, it's an exponential increase. So it's now, 1 out of 4 to 1 out of 16 as likely that you will develop a COVID infection if the person had COVID. So can you get it? If you've been vaccinated, I think you're probably pretty safe to get it. I would still have them wear a mask, and I would still wear a mask because you don't want to get a mild infection. You don't want to get any infection. But that's a judgment call. And I do think it can be relatively safe. Again, what do I say? Live life, but be smart about it. Don't stop drinking water just because of all the side effects I told you about. Don't stop living just because COVID's out there, but be smart about what you do. And it's your choice. If you really got to have that massage, go ahead and do it.
May I add my own personal non-physician advice? Wear a mask, have the masseuse wear a mask, and be outside. This is San Diego. You
Absolutely.
could get a mask. I had some neck issues after too much stress and too much typing, and the massage, I needed it. I was just half crooked. So my favorite massage therapist was wearing a mask. I was wearing a mask, and we were outside. So that the relief I got and just the pain that subsided immediately after that was just worth every risk.
Yeah, the pain relief, the stress relief, all fantastic. This may be too much information for this audience, but being out in the sun is actually a great way to kill the virus. It cannot survive very long in the virus. So I actually proposed quite a while ago that everybody has to go outside naked for 15 minutes on a sunny day, and that would get rid of the virus very quickly across San Diego. So not that I'm really recommending that. Please don't do it and say Dr. Hoffer said so, but I'm just telling you, get outside in the sun, you'll feel better, go for a walk, get a massage, and do it wisely.
Dr. Hoffer, this session is recorded, so.
I can see Channel 7 taking this and
No, too late.
Oasis is advertising their nudist walk, COVID prevention walk this spring. Sign up at this.
Perfect.
Yes.
Better than getting COVID.
Thank you so much. I appreciate that. Next question is for April. April, we have a couple of questions about how could we potentially be considered to be PACE clients? What are the financial requirements? What are other requirements for us to know, either for ourselves or for other people we might know?
Okay. Well, if you are 55 years and above and you live essentially in the North County of San Diego, you can call our main number. That's 760-280-2230. And one of our enrollment team members will reach out to return the phone call. And they'll basically kind of have a questionnaire of getting your general diagnosis, where you live, what kind of things you need help for. Once that screening process is done, then we send out a enrollment RN who goes a little bit deeper into each and every single diagnosis, into each and every single one of your medications. They assess the home for safety, kind of pick out what things that we could do and change. Is there any bathroom equipment that you would benefit to allow you to stay at home safer? We essentially gather all that information and submit it into a form to send to the state. The state then tells us whether that person has met that level of care need. Once that level of care has been approved by the state, we just need a signature. And then you would basically start with our program the first of the following month. We are a primary care office as well as your insurance company. So on that first, whatever your previous health insurance be, it would switch to us. And we're basically an HMO. We have our network. Everything is decided for medical need versus wants. We have a team, an IDT team, interdisciplinary team, physician, nurse, physical therapy, occupational therapy, registered dietitian, recreational therapist, social worker, personal care attendants. We all come together with everybody's specialty to decide, is that something that someone needs? What kind of specialists, what kind of things they have. As far as financial, most of our participants are dual certified with Medicare, Medi-Cal, because that does provide them the ability to have zero out-of-pocket costs for everything that we provide. We do accept private insurance. They could be Medi-Cal, but not Medicare because of age or vice versa. I don't really know the specific details on number amounts. That's not really my expertise, but if you call that main number and speak to our enrollment specialist, they would be able to walk you through all of that and answer that better than I could.
Thank you so much, April.
Of course.
We will return to Dr. Hoffer for the next few questions of medical nature, and they have to do with the joy. I loved how you brought the joy of looking forward and living. One is, and both have to do with grandchildren. First question is it okay for me if I'm fully vaccinated to not wear a mask and play with my grandchildren? And then the second one is a variation of, my grandchild is about to get born. I want to be there. I've been very careful. I will be wearing a double mask and a shield. I will be getting on an airplane, getting to the place and staying isolated for 10 days. Can I go see a brand new baby? Is that safe enough? So if you can help phrase some of these questions.
Those are great questions. So I would say if you're going to visit or play with your grandchildren and you've been vaccinated, you're going to have to do that eventually anyways. You can either wait till they're vaccinated or do it now. When children get it, many of them don't even know they have it. And in fact, the flu has a higher mortality rate for children than COVID. So if you weren't seeing your patients during your grandchildren during flu season, I wouldn't see them now. But if you did go see your grandchildren during cold and flu season, I think you probably can. Again, wash your hands. But you know what? The medical human value of being with your grandchildren, hugging your children, having peace of mind and joy in your life is a real human medical issue. Guess what? Your diabetes will do better. Your heart disease will do better. Your mood will do better. You will sleep better. You can come to see me and talk about all the pills I can give you for those things. Or you know what I prescribe? Go see your grandchildren. Now, for a newborn, it's a little bit trickier because there has to be a lot of people in the room. And even a newborn is going to get some passive immunity if the mother had COVID or got the vaccine. And so we're considering giving the vaccine to pregnant mothers. And they still would do very well, but you do not want to in any way be engaged in the risk that you caused a problem. So I can't tell you medically whether you should go or not. If you're going to go, I love everything that was listed there. If that value equation and the permission of the mother and family says it's okay, I think it would be okay to do that, but just be smart. That's all I can say about that.
Great. Another lighter question, since you're giving such great advice. What about haircuts and pedicures? Are we safe to do that?
After my third haircut, yes. So of course, I always managed to get the haircut for the week it opened up and then it closed right down because I just don't like having long hair or growing a beard like Dr. Druck. So that was my style. I took the risk. I wore my mask. You had to hold your mask up to your face while the barber was doing all their stuff. They had a mask on and, it was all worth it to me. And I even did that before I got both of my vaccines. So again, if you think you're safe to do it, if it's worth it to you in that value equation, I would go ahead and do it. And people weren't waiting in the barber shop when this was occurring. We all had appointments. I could make my appointment online, and those are better places to go. And pedicures, pedicures are so far from you. If you're 6 feet tall, you automatically are okay to do it. The person at risk doing a pedicure is not. So again, out of respect to the person who is doing the pedicure, wear a mask, even if you've been vaccinated. Just a smart and kind thing to do. And if they're letting you come in, because one of the things we did not talk about today is the economic suffering that leads to morbidity and mortality in our population. They need your toes. And my barbers needed my hair. And so I gave them more than what they charged intentionally to keep them going.
Thank you for bringing that point up. This is really important and very kind indeed, very considerate to wherever we go and whose lives we impact, whether by hugging or giving business to the people and business owners we love and cherish. Okay, let's see. Interesting question about the vaccine. So we'll stay with you, Dr. Hoffer. The comment is that older people are having fewer side effects to the vaccines. Does this mean they have a lower level of immunity?
It's true that seniors have an lower level of immunity in general, and that's why if you have a very older person, it's better to vaccinate the people around them. For example, with the flu shot, than just give the patient the flu shot. There's also a senior flu vaccine now that's a little bit stronger. May or may not be of that great a benefit, but the reality is you develop what's called immune senescence as you age. So it's not just about you getting immunity, it is again the social responsibility to the people around you and how much you want to believe in that and engage in that. I believe in it greatly, so I encourage my families to get their vaccines, which the loved ones are always shocked about when the patient comes in to see me. I say, well, the person who really needs to get the flu vaccine is you. Have you gotten yours? And yes, the patient should get it too, but that's because of that decreased immune response. And that's normal as we get particularly older. Other people on immune suppressants, they're particularly at risk too, and you have to think the same way for them. And you cannot walk in a library, in a mall, in a doctor's office, to a ball game and know who is and who is not immune suppressed. You just can't know that. So as a social responsibility, again, if you want to protect the people around you and you love, and certainly the older population, yes, they're probably not going to have as much of a response, but the people around them should get the vaccine. They will still get a response. And you can't know which senior is going to have less of a response than more, so everybody should still get that vaccine.
Thank you so much. The next question is for Dr. Druck. Dr. Druck, we may have a very different perception of how we're going to make a decision to see a person or a sister, brother, neighbor versus being in a crowd environment. being in a ball game, being in a restaurant, being somewhere. How should we think about that? What about the crowds?
You know, Dr. Dan said it beautifully. We all have to do that risk assessment. Do I want to play with fire? Do I want to expose myself to danger that will not only affect me, but might affect people around me? Or do I need to be patient and play it safe until more people are vaccinated? Do I need to reduce that risk benefit, to reduce the risk and be patient about the benefit? And, if you're asking me personally, I mean, I love the Padres. I haven't missed an opening day for years, but I'm going to miss opening day. I'm just, I'm going to watch on TV, and I'm just going to, that's the way I'm going to deal with it. That's my personal decision. And I will wait until it's safer to go to a ball game and to go out and be in a crowd. Right now, my priority is keeping myself, even though I'm vaccinated, keeping my all the people in my family that are older safe, and keeping my grandkids safe, and just playing it safe. But I think all of us have to make a decision about that, and hopefully we're going to exercise. We're all, we've all got cabin fever. My goodness, we've all got it. We all want to burst. We all want, to go and hug our neighbors and hug our friends and get out into the world and live. And many of us are still grieving the loss of all those things we used to love to do. Go to the symphony, go to the ball game, get out. How about all those of us who are grieving Costco? We are used to retail therapy at Costco, but they had it for a while. You could go in at 8 o'clock to 9, and you'd be in an empty Costco with first responders and a couple of people your age. But we all, if we can all just take a deep breath, exercise patience, do the good things that we've been doing to get by, advocate that other people do the same, so we can all arrive in a future where it's really safe again to be in a crowd. I'm doing something tomorrow. I had this crazy, I got to tell you guys, I have this crazy notion for all my neighbors. I live in a community, and I hired opera singers to come into my community. And tomorrow afternoon, they're coming in. We all are going to be distanced from one another. It's outside on the hillside, on a beautiful hillside. Everybody's socially distanced. I've asked everybody to wear a mask or not to come. We've set everything up. And for an hour, we're all going to listen to opera together in a way that we have not been able to in the past. And it's not going to be all the music from Les Miserables, trust me. It's going to be happy show tunes and everything. So let's make adjustments. Let's do what we can, like this beautiful podcast. Let's wait and be hopeful that we can gather. If you're like me and you're going to stay on the side of playing it safe until it is safe.
So at this time, we have about 9 minutes left for our scheduled time. And I know how busy the three of you are, and I want to be extremely careful with your time. Any last parting thoughts on any subject we've talked about today from each of you? And then for the audience, as we're listening to some last comments, I'd like to ask you to think about if there are some other burning questions that you have that are relevant that we could tap experts and put the next webinar on to facilitate a similar discussion. So that's the question for the audience. And I will call on Dr. Hoffer first for any parting thoughts. I'm delighted that you're planning on French and philosophy classes at Oasis. I'm celebrating with you that you're reading non-medical literature at this time. I always have a pile of pleasure and a pile of business visually stacked on my bedside table, and I scold myself if I'm too deep in one or the other. So Dr. Hoffer.
So fantastic. And thank you again for having me here. What I would say is that the lessons of COVID is something we're just going to learn all together, but these are the lessons of life. These are the lessons every time you have a trauma and get through it. But we're learning it at the same time, and the joy at the end of this game is going to be fantastic. I hope it creates meaningful internal and external changes for everybody, that we value the time and the society that we have. And I'm telling this particularly to this audience because it's seniors, is that you are going to live a lot longer than you ever thought when you were younger these days. We have the tools, and myself and my journey in healthcare is to continue to get that quality of life as the primary goal of healthcare, in addition to the longevity. So make your life meaningful, find external and internal meaning to your life, love your family and your friends and the activities that you do, and be smart about it.
Excellent. Thank you. April, any thoughts from you?
Just echoing his sentiments. Thank you for inviting me to be a part of this. It was a pleasure meeting all of you guys and sharing our little part of our life. Parting thoughts is, there's a thing that we say a lot, at the end of our meetings, is that we're all in this together. That's our patients, that's our staff members, that's our families. We're just in this together, and just keep being positive and knowing that there's a light at the end of the tunnel. We've gotten this far. Just keep being safe, keep being smart, and we'll see each other on the other end.
Thank you, April. Dr. Durock.
I love that. Let's be safe. Let's be smart. At the same time that we do it, let's not allow any of the differences that we've allowed to separate us into an us and a them, to interfere with getting through COVID, getting to the other side of this. Let's not allow that. Let's talk about the common good. Let's talk about all the things we want that are the same. All the things we want, the wellness, the love of our children, grandchildren, our community, and the blessing that we live in the country we live in the community we live in, with all the resources we have. And let's be compassionate as we do so. And the last thing I want to say is that as we go through this as individuals, let's be human. Let's keep that hand on our hearts, because you know what? We're complex. We could be feeling sad and happy. We could be feeling alone and loved and connected. We can feel all those things. We don't have to live in an either or world. We can live in a both and world and accept the totality of who we are as human beings, that we could feel this way and that way. But when we divide it and we have to make it either this or that, we get confused and we dismiss the fact that that's our humanity, so that we can feel a bunch of things at once. And let's pay attention to those things, listen, become our own best friends, listen to ourselves, and move from that place forward.
Beautifully said, Dr. Druck. The and is probably always with us, pandemic or otherwise, in life, no matter what we're doing. I want to thank each of you. And my parting thought would be very much like you, what you said. I've been hating this year and watching my 10-year-old daughter be at home in front of her screen for a year. I've had so much anger for the politics of the school district and teachers unions and what that meant for students. I would have volunteered to be in prison of virtual work for the next decade in exchange for sending little kids to school and for their overall health. However, there are so many beautiful things that I'm grateful for. And probably one of the simplest ones of them is that I have had lunch with my 10-year-old every day for the last year. We took the 20 minutes or longer to eat lunch together. which was such an incredible treat. We will never have that chance again. She will be at school, I will be at work, we will all be busy running around. So with that gratitude, and very much like you said, Dr. Druck, you know, let's take the pedal sometimes of the negativity and the pressure and put that hand on the heart and find that grateful something. And if we listen to Dr. Hoffer, let's take a lap, get some sun and kill that virus, take a massage, go see a barber. There were a few resources posted in the comments and chats. If you need a vaccine and you're looking for where is a good place to get more information, 211 is a good place to call. And that literally is dialing 211 on your phone. There's a team that can help you navigate depending on where you live. And PACE centers are also, as April mentioned, sometimes geographically restricted. Gary Mary West is in North County. There's others in different parts of town. Should that make a difference for you and be a helpful resource to you? And again, I'd like to assign 2 action items or 3. One to Dr. Hoffer to re-educate his fellow physicians so they don't show up at work sick, you know.
Yeah.
Stop being hypocrites and stay home when you're sick. All of you who are attending, send us some feedback about, was this helpful? And what other topics are burning in your minds and hearts that we could tap experts to help us think through. And again, my tremendous gratitude to all of you for registering, for showing up, and for definitely the talent and time from our experts. Thank you for joining us for this conversation. I learned a lot. And I'm grateful for your energy, your thinking, and I hope to see you again, hopefully talking not about pandemic, something else, something more joyful. Thank you so much. Have a wonderful Friday afternoon.
Thank you all.